the Paula Show is on, and we inspire, entertain, and transform behaviors. It is for this reason that we're sharing with you information tonight about substance use disorder. Let's go to what I consider to be the worst drug ever: alcohol. I've seen how alcohol has destroyed families, destroyed careers, even young people. And within Antigua and Barbuda now, there are so many feds that are offering alcohol. I don't understand why the government doesn't do something about this, because these young people with their liver issues, their psychological issues, medical benefits will have to become involved in that. So it's a cost to the government when you have all these intoxicated people around the place. Accidents, people being maimed, yes. I can go on and on and on and on. And alcohol seems to be a social drink, right, as opposed to a destructive substance. That's my introduction. What do you experts have to say about alcohol?
I totally agree. Alcohol is a toxin. It's a toxin.
Yes.
It's a destructive substance. People are able to have a glass of wine, a drink, and be fine. Research shows that if you are before age 15, if you start using alcohol, there's much more of a chance of you becoming addicted to alcohol. Do you know what the leading preventable reason for, it used to be called mental retardation, it's called intellectual disability now. Do you know what the leading cause of that is?
Alcohol.
Alcohol, fetal alcohol syndrome.
Yeah.
Fetal alcohol syndrome.
How can somebody be pregnant and consume excessive,
because it's an addiction.
It's a disease.
It's a disease.
So even if you're pregnant and you know that
it will hurt
if I take alcohol, it's gonna damage me,
yes,
and damage the baby,
yes,
that alone is not enough to make you stop. At least in most cases. Some people, and a small percentage, but in most cases, that alone will not make a person stop.
If they are truly addicted to it, their body sees alcohol as a survival need, like water or food.
As your
food,
best friend in a storm, so
right,
to speak. Okay, your best friend in
danger. That's how the brain changes.
Despite all the focus on illegal drugs, such as cocaine, alcohol remains the #1 drug problem in the USA. Almost 17 million adults in the US are dependent on alcohol. When I read this, I said, wow.
Yeah.
Well, see, Paul, you're bringing stats from the US. And although I can't tell you I know all the stats from Antigua or Antigua and Barbuda, we have a serious problem here,
absolutely,
especially amongst our young people. And one of the things that I even said recently on another forum is that we need to have laws to prevent our children, because I call them children,
yes,
from drinking alcohol.
Of course.
Because like Lynn mentioned, the earlier you start using an addictive substance, the greater the chance that you have of becoming addicted to that substance. So when we have our teenagers between the ages of, let's say, 10 to 18, 19,
right,
starting alcohol, start their first use between those ages, they run a high chance of being addicted. I call it like the damp concrete effect. The brain is not fully formed as yet.
Yes.
So the imprint that you put with that alcohol use is going to stay there and grow with you, as opposed to when you're much older. So we have to arrest that situation at that point now.
Yes. Do we have 10-year-olds drinking, doctor?
We have 10-year-olds, we have 9-year-olds, we have 8-year-olds, we have in Antigua and Barbuda here, yes.
Drinking?
Yes, we do.
Consistently?
Consistently, my good friend. Okay.
And parents are aware of this?
Sometimes they are, sometimes they're not, but usually somebody is drinking.
But
somebody
you have
else is
to
going to
know.
Somebody,
the mood change.
Somebody's going to know.
You have to smell it. Because when my teenagers would go out, especially one, I would make sure that when they return, I'm sniffing like a bloodhound. And especially that one, he would say to me, Mom, I don't drink. Why do you do it all the time? I just want to make sure. So I'll be sniffing, walking behind and sniffing. But I'm sure there are ways of masking.
As a parent, it's
Yes.
your job to, as I said the other day, get in your children's face.
Yes.
You don't abuse the children. And when I'm not talking about abusing the children,
Yes.
I'm not talking about being mean to them. I'm talking about being a parent. And children are smart, children are very savvy. We have to get in their faces and find out what they're doing.
Yes.
And one of the things I've noticed, and the stats will bear me out on this one, that in Antigua and Barbuda, that age group that I mentioned earlier, between 10 and 19, we actually have more girls who are drinking alcohol than our boys. Okay? It used to be the opposite way years ago, ago, but now we have more girls, more teenage girls drinking alcohol.
But why is that though? Well, I know we have more teenage boys dying in car accidents, and the traffic officers would say to me it's because boys are more daring, they're more showy and all of that. But what would be the causes for girls though consuming alcohol so much more than the boys?
I'm not sure there's a cause, and some of it might be peer pressure, but I'm not sure there's a cause because peer pressure works with boys as well. I don't know if Lynn has any insight on that. But,
I was looking at the Caribbean statistics, and that was one that just threw me, starting in 2010, seeing the information that they got specifically for Antigua and Barbuda.
Yeah.
Alcohol use is rampant. The statistics that I was looking at started at age 14, but the question was lifetime use, asking a 14-year-old lifetime use.
Exactly.
And we still had 27–30% of these 14-year-olds saying yes. And then more girls than boys. I don't know. We could.
Do you realize that this age group that you've mentioned, they're the ones in secondary school?
Exactly.
Yes. Yes.
Yeah. And
So we have a
schools,
bunch of young people going to school every day. They're probably even drinking at school.
Well, remember we said that it can be a genetic predisposition toward this. And so what you often see is an intergenerational family dysfunctional situation where you have family members who have normalized this, that this is what you do. And so it just continues to be seen as normal or as a rite of passage or whatever. It's in your environment and, you know, drink water, drink alcohol.